Good morning, everybody, and welcome. My name is Tamsin Rose, and I have the great pleasure of being both the Senior Fellow for Health at Friends of Europe and your moderator for this morning for our conference, our summit looking at innovation in health. So thank you for joining us. And just to take you through today, our first session is going to look at the critical issue of how do we empower patients to have a greater role in their own health. Then after the coffee break, we're going to have a wonderful ideas sharing from Lubna, who's going to give us some insight into how we make the AI transition human-centered. Then we'll also be discussing how to do the green transition in health, something that doesn't necessarily get on the radar of many health professionals who are obviously focusing in the crisis of today. And we want to make the link between the crisis of today to the crisis of tomorrow. And our final session is going to look at the fact that Europe is aging, and that has a huge demographic and societal shift. And we want to know, are we delivering enough? Have we prepared enough for an aging Europe? And what might this mean for our health systems? So that's our focus for today. And I'm delighted that to open, we have a message from the Minister of Health and the Deputy Prime Minister of Luxembourg to open our session. So let's watch the video message from the Minister.
Dear friends of Europe, while I'm unfortunately not able to join you in person, I'm very happy that I can nevertheless say a few words in support of your valuable efforts. The theme of your conference, Reimagining Health System, Green, Agile and Citizen-Centered, was very well chosen, and it hits the nail right on the head. So let me explain why I believe this is to be the case. The 21st century is marked by a number of trends with great consequences for our health. Climate change, aging populations, and intensified globalization in trade, travel, and migration are among the most crucial factors shaping the modern society, with a great impact on the human-animal-environmental interface as well as on public health. Climate change in particular poses a great threat to our health and well-being. Yet the healthcare sector in itself is a major contributor to greenhouse emissions and a source of pollution. It is crucial that we innovate and find ways to accelerate the green transition. The healthcare sector can lead the way as a field, making sure we meet our climate goals. Europe needs to take on a leading role and act as a trailblazer in this regard. New health technologies and green solutions need to be pushed and need to be adopted. All citizens will play an important role in this transition, as we are given more and more opportunities and also responsibilities to manage our own health through new technologies. These new technologies entail the production of valuable data holding great potential to better understand people's health, including those with rare diseases, and these new technologies also use this information to improve our understanding, to target prevention efforts, and to develop new treatments. Europe's population is aging, which will increasingly put pressure on our healthcare systems if we do not act now. We must increase our prevention efforts and health literacy to encourage a healthy lifestyle and reduce preventable and non-communicable diseases. We also have to make sure that our systems work as efficiently as possible, fostering effective multidisciplinary collaboration, both on the national level and across the European Union and even beyond. In addition, we need to address social determinants of health. Socioeconomic and demographic variables have been proven repeatedly to determine the health status of an individual. We must ensure health equity, and we must invest in the present in order to make sure that we all grow and age well. Challenges, but also great opportunities, lie ahead of us, and it is at forums such as this where we are able to share ideas, to coordinate our efforts and hold ourselves accountable for what we do, to innovate our healthcare systems and improve, in the end, public health. Let me congratulate the organizing team for putting together such an engaging and thought-provoking event, and let me all wish you very fruitful deliberations.
Thank you very much for that message from the Minister. So just to put the context for today, healthcare is constantly evolving, but in the last 2 years has had to accelerate the change. And part of what we've seen has been a shift out of healthcare institutions because we were unable to get to the healthcare institutions because of COVID. And that accelerated a change, a shift to telehealth, to people using more wearables, more various other tools to monitor themselves. People had pulse oximeters at home. So what we're seeing is an enormous change and a shift. But at the same time, we all became immersed not just in data, but misinformation. So here's the big challenge. For citizens to continue being stronger, empowered actors and agents in their own health, we need to explore both the framework for data, how people can use it. We need to continue the shift in practices that we started at the beginning of the pandemic and to see where we can build on that. So in this session, we're going to explore and take the issue of rare diseases, because if there's any area in healthcare where patients and their families have been forced to become real actors for change, it's in rare diseases. And in our session, we'll cover some of that to understand what of that gives lessons for the broader aspect of healthcare. Now, we are going to be using Slido to engage with you, so please make sure you've got your phones ready, because I will later be showing you the QR code for that, but I'm just giving you a note. We'll need your phones because we want to interact with you. But I'm delighted to start by turning to Stelios Kimperopoulos, who's a member of the European Parliament from the EPP group and also a well-known champion for health and particularly for rare diseases. So let me start by asking you, Stelios, what is Europe's role in supporting health systems that work for everyone?
First of all, I would like to thank you for this very important topic that we are discussing today, and I think that it's very optimistic to talk for health issues on a European level, and I'm glad that this is accelerated, as you told before, from COVID. And it's a very timely issue that we are in the time of discussing for a health union. So yes, we need to discuss again and again for the health. And regarding your question, as we all know, primary responsibility for health issues are not in the competence of union, but also but the competence of member states, and the EU has many tools in order to support the strengthening of a health system, including policy statements, funding, information, and technical assistance. The COVID, as I said before, the COVID-19 pandemic has been a period of enormous disruption to health systems and far beyond, which has led to rethink our policy goals and objectives. This is a pivotal time for establishing EU support for health system with a new multi-annual financial framework and post-pandemic policy orientation emerging. And we need to stick on what happened with pandemic 19 because the European Commission made proposals for this so-called European Health Union, which includes specifically strengthened provisions for pandemic preparedness and response over the coming years. Therefore, we have EU for Health for the new financial period, 2021-2027, provisions for greater coordination at the European level in responding to cross-border threats. And we have expand from Commission side, but also from European, from Parliament side. We have expanded and strengthened the power of EMA and DCDC. And also we have created another tool, another office in order to create a better coordination among the different offices, and this is here. The COVID-19 pandemic has highlighted the need for the EU to have a rapid response capacity to enable to react to major health threats in a coordinated manner. And I think this is the core of all issues. We need coordination among member states. And I finish saying that the EU is supporting the health system in many ways, financially, politically, and socially. With the recently published European Care Strategy, it gives enhanced recommendations to the member states for personalized care. While with the Europe's Beating Cancer Plan, it encourages prevention, early diagnosis, treatment, and follow-up. I think that with the upcoming regulations, SOHO, EHDS, and the revision of the pharma legislation, orphan medicinal products and pediatric products, the EU is aiming to address all the current gaps and ensure faster and better access to treatment. So I think that we are in the right moment for a holistic approach.
Thank you, Stelios. I mean, you've set out for us the way that the institutions have ramped up their capacity through agencies, through the upcoming raft of legislation. There's a reinforced budget for this time round, but we're about a year away from planning for the next European elections and the next mandate. As someone who represents citizens, when you go to them next time to ask for their votes, do you think Europe can meet the expectations of what citizens want from them? With everything you've just said, the greater mandates, the structures, are we able to meet the ambitions? Is that what citizens want?
I believe that everybody understands, any house understands that we need a center-based medicine and treatment. And the citizens have felt the need to increase the resilience and capacity of health system, especially during the pandemic, and how we need to take the lessons that we have learned from the pandemic and put them into the future, in a possible future crisis. Equal access to treatment, to increase, to have the lack, not to have lack of shortages, and lack of resources. These are the main things that in the European Union health we need as priorities. With its policy actions and plans, the EU can help address the medicine shortages and help balance geographical distribution of health workers, and can also offer an enhanced supply of critical medical products. Therefore, I believe that EDSS, European Data Health Space, can improve access to and strengthen primary health care, and providing easy, reliable data and exchange best practices among member states. I believe that we are close on what citizens want, and I'm very optimistic that we can accomplish their needs.
Thank you very much, Stelios. It's at this point in the agenda I'm going to be asking for your input, so phones at the ready, please. We're going to ask you a Slido question, and in a moment we'll be putting up on the screen the QR code, but you can go to slido.com, and the code for our conversation is 354491, or as I can see you all doing pointing, I feel a bit like being in a music concert. You're all pointing your phones, not at me, but at the screen. So it's 354491. And the question that we're going to be asking you is, we want to know what will be key to empowering citizens to take a bigger role in health. And we've given you a number of options, and you can choose several of them. Can I ask that you not click on all of them, but you choose 3, because otherwise the answer will be everything's important. But we want to get a sense, and remember we're in a context here looking at what Europe could deliver. We heard from Stelios that he's very optimistic, and he sees Europe putting in place the structures, the framework, the legal grounding that would allow some of the issues, but also the equal access to care. I know that last night we spoke about the challenges, particularly for Greece, meeting rural communities on small islands. So there's a huge expectation from citizens. So what would be your priorities to make a change in that? And so far, 61% of you are saying that actually it's change in practice by health professionals. Now that's a cultural shift, and I know we have speakers in the audience who might want to talk to that and respond to that. But also health literacy coming through now, that's a little more popular, 58%. So clearly the 2 winners there it's the population health literacy, and I referred to the amount of misinformation that's out there on the internet. Last week I was moderating an event for the European Commission, DG Justice, and one of the areas they were looking at is how do governments respond to influencers on social media promoting either banned products or taking products and promoting them for uses other than that of the manufacturer. And actually we had people from all around the world, from Peru, from Brazil, from India. This is a global challenge. So this issue of health literacy is absolutely key. But thank you for that. Funnily enough, access to your own data is so far not a particularly popular choice. So far only 20% are saying that that's going to be key to delivering change for our citizens. So we'll just close the poll there at that moment, and I may ask if we could freeze that. I will come back to that and ask for more. Now, our next speaker, Elina Draviek from Sitra in Finland, they are leading the joint action called TEDAS, which is towards the European health data space. That's what it sounds describes. And this is where member states and stakeholders come together to try and put in place the building blocks of the European health data space. Now, I don't know if you were surprised by the fact that access to your own data was at the bottom of the list, which was a surprise to me. But what you've been talking to member states and stakeholders in this joint action. I know it's not finished yet, but what are your main takeaways so far?
Well, I have to comment also first on this poll a little bit.
Wait, we're just going to... Yes, it's
now
on.
it's on. Okay,
Yeah.
yes. I just wanted to very briefly comment on this poll as well. I think it was very good questions, but how I also pictured is that now we are getting already towards to better access for citizens of their health data. So maybe that's not the key anymore because we are going towards that direction. So what's next is really needed is this health literacy part and also changing the behavior and the whole how the healthcare system works, and the role of healthcare professionals is pushing and empowering patients more to being active agents of their own health. So maybe that is one explanation, but it will be very interesting to hear more from the audience who actually voted, that what were your thoughts on this. But yes, to the question that you posed, so yes, we are positive. We have heard positive reactions from the member states on the broad lines, the broad terms in general. But there are, of course, a number of small details to be negotiated and to be tackled and to be clarified. And one of them is, of course, the sort of bigger picture on the legal clarity and also the complexity of the EHDS proposal as a whole, because it's not only EHDS, but it's also the Data Act, Data Governance Act, Artificial Intelligence Act, Cybersecurity Framework, and so forth. But it is indeed, as Stelios said, is the main building block of the European Health Union. So we are very much looking forward to getting there and to pushing it forward. And it will be an important step for the citizens, empowering citizens to have more control of their own health data and how they could be promoting that for their own health. Yeah. In TEHDA's work, we have a work package on citizen engagement, and the preliminary results from the questionnaires and the workshops that we have had with citizens in 3 different countries, in Belgium, in France, and in UK, is that citizens are willing to share health data, but of course with certain safeguards. So they want to know that it's safe, it's secure, it could be anonymized data, but also sometimes not. So it depends also on the purpose. But what citizens want to know is that they want to know where the data is used. So I guess there we still have some work to do. And then there are also some concerns on this privacy and security aspects and what could be the potential sanctions and penalties, and maybe these should be made more transparent also in the proposal.
Thank you, Elina. And let me just ask for a brief comment. We've got huge hopes for the EHDS. A lot of people are hoping this will transform our understanding of our health systems. It will transform health outcomes. So there's a lot of hope riding on that. As someone who's worked on it for a year or so, how hopeful are you that the EHDS will deliver what we want from it?
Well, of course, we have to be hopeful. But definitely, I am positive, but it doesn't come automatically. So we need a lot more work. We are just in the beginning of the journey. And we just also need to intensify all the actions. And one of the key issues is the capacity building and also the health literacy, but also the digital literacy, not only of citizens, but also of all the health workers. I can tell a short example because I work at Sitra, the Finnish Innovation Fund, and we also fund pilots and experiments. And we have one on digital therapies. We have different projects on digital therapies. And the first experiences that we have had from these pilot projects is that citizens are very much interested in engaging and using these new tools and technologies for the benefit of their health and managing their disease and to have better treatment and also the patient journey improvement. But it's clear that they need support for these digital tools, tech support. And this also goes for the health professionals. So they want to have support for using it. And it's very important to have the training as part of the introduction of these new digital tools. Okay. So I guess this is one of the key issues.
Great.
Yeah.
Thank you. And I'm sure as we talk a little bit more, one of the key elements is not just the training for the citizens and patients on how to use the tools, but it's that change in behavior by professionals, including the skills and capacity for them to use the tools as well. Let me now bring in somebody else and it's Yann Lecam who's joining us remotely from Paris. Unfortunately, he was unable to travel because he wasn't feeling very well, but is well enough to join us. Thank you, Yann, for coming here. Now, I mentioned at the beginning that we're going to use rare diseases as an example of what it looks like when citizens and patients are empowered to be agents and leaders of change. So what can you tell us about that journey when patients have been forced to come forward and shape the agenda? How did that happen?
Good morning to everyone. Thank you, Tamsin. There could be several examples, and I will give two, but let me explain that maybe the way we work to help understand how we try to have that kind of impact is that as a community, we try to convey the needs and the experience of the people living with rare disease and their families based on evidence. So we believe in evidence-based advocacy toward evidence-based policy. And how we do that, we at the same time collect quantitatively the data, so quantitative surveys, and for that we have a tool, the Rare Barometer Voices, where there is now 20,000 families across Europe who are committed to provide data on different subjects. So they answer to quantitative surveys on a regular basis. And we had that, for instance, on the collection, use and reuse of health data for healthcare purpose and research purpose. But we also have qualitative methods of interviews, focus groups, Delphi methods, and other even more innovative methods of engagement of citizens for consultations. But we also use the testimonies, the videos, the written testimonies in order to bring to the surface really the reality of the people. And that is what we're trying to do all along in order to be real and connected to the diversity of situations also across Europe and according to the disease areas. That translates into some significant changes, I think game changers in terms of policy and services. In the pharma legislation, for instance, back 25 years ago, we pushed really with some member states in that period to have patients in the scientific committee of the orphan medicinal products. And this was the first time that in a regulatory agency in the world, there will be 3 patient representatives along the experts from the national regulatory agencies. And this positive experience then translated into similar patient engagement in scientific committees for pediatric medicines, for gene and cell therapy, in the advanced therapy committee, but also in the pharmacovigilance committee, and now even in the preparation of the risk-benefit assessment in certain situations. And patients every month are going to scientific advice and protocol assistance of EMA. Really, Europe, with the European Medicine Agency, has led the way of patient engagement because of this type of experience, which was first initiated in HIV, but really was scaled up with rare diseases, and now across all health areas. A second example is that when the cross-border healthcare directive was prepared, this patient community on rare diseases really advocated and tried to shape some of the key concepts, and particularly around the future European reference networks, which became, thanks to the work together between the community of people affected and clinicians, then to develop the 24 European reference network on rare diseases. And this, it's the same time, at the same time, the compass of what are the needs and experience and expectations of the persons living with the disease, but it's also always the collaboration with the interested parties, with the stakeholders, the clinicians, the hospital managers, the member states managing the healthcare system in that example. But maybe to conclude on the example on the European health data space, we've been very cautious at the beginning to say what the perspective of patients, because in fact there was no study really performed by the academia from that angle. So we waited to do the study that I mentioned before, a survey across Europe, in order to see what really want the people, what is their experience. And in fact, it was very clear. It's that it's overwhelming. Over 98% of them want to collect the data about their health, want to share it, and to share it for research and healthcare purpose, not only for their benefit, but for the benefit of all the people affected by their rare disease, or even broader by the society. So there is really an authentic generosity. But what they want is to be protected from the undue consequences. And that calls really for an ethical and secure manner on how the data are managed. And to do that, the patient voice into the policy shaping, but also into the governance after that of the systems and of the data is absolutely essential.
Thank you very much, Jan. Let me now turn to Maciek Gaszewski from Alexion. We just heard from Jan how Europe was at the forefront of giving patients space and a role within regulatory agencies. Can you give us some insight from your side? How has the role of patients changed over time?
Thank you, Tamsin, and good morning, everyone. I think it's a really interesting case, the rare disease field, and Jan has already spoken about the examples of change making. I think the patient community or the broader rare disease community have really played two major roles, and the way we see this. I mean, one is really the change makers in terms of how the society has completely shifted on their understanding of the needs of the rare disease community, and what should be the responsibilities of our European societies in terms of supporting this important patient community, which, let's remember, just 20 years ago, I mean, was not really on the horizon at all. What we have achieved over the past 20 years, the level of mobilization, the level of awareness, the level of support and commitment is unprecedented almost. So, and this has mostly been because of the societal patient voice raising and really creating this significant change. And that change has not only led to the regulation, it has led to government rethinking of how to integrate a problem such as rare diseases into the healthcare systems, which was a difficult task. And I think we are evolving so much more into a system right now where rare diseases are not so much on the periphery of the system, but are becoming a standard element of the healthcare system, and hopefully this is going to be even more so in the future. So this is amazing. But I think from the company perspective, and Alexion has been in the space of rare diseases from its inception 30 years ago, I have to say that from the company perspective, the patient role and the patient voice is also important in terms of driving innovation. This is an absolutely incredible source of not just inspiration for companies, but perspectives, insights, and data that the companies work on to advance their innovation. So Jan mentioned the evidence-based approach from the patient community. This is so critical. We within the companies, we rely on this evidence, we rely on those perspectives to research, to start with, to understand diseases which we want to try to address with our future solutions, then to design trials and actually make them designed in a way that actually respond to or address some of the key challenges that patient community has in relevant disease areas. And it's not very straightforward because there's a lot of, let's say, innovative approaches that is needed to do this. But then it goes even further. I mean, understanding the patient journey and really the every element, every step of that patient journey in every disease is full of very relevant information that we as the companies try to co-create together with the patient community to design the solutions that will actually be the ones that help. So it's not just the products, but it's all sorts of services that you can build and develop to support the needs of the patients which are very special. So I think we have been moving from over the past 20 years or so from a system where, okay, there was we always have been close, but now this co-creation and collaboration between the patient community or broader rare disease community and the industry has really intensified for very, very good reasons, and I think rendering amazing outcomes for the entire community. So this is the time, I think. We've never had this. I mean, this is so promising, and it's with the science and technology catching up or even advancing faster than that. I think that that field will see amazing opportunities in the future.
Thank you, Maciej, to describe to us just how revolutionary the change has been in the last 20 years. And I know that the rare disease community want to continue that momentum in the next mandate by getting a strategy at European level on rare diseases. I'm now going to open the floor to questions or comments on what you've just heard. And remember, what we're trying to do is explore how citizens and patients can be empowered and play a greater role. We'll get you a microphone, and if you could just briefly introduce, say where you're from.
Can I make a
Yes, of course,
comment?
Stelios, you're welcome.
Yes, and thank you very much that you referred to that we need also, along with the pharma and the treatments, we need services, because the disease is also a social issue. It's not a medical issue that we need also not just to treat, but we need to create an environment which supports each individual. And this is, I think, the revolution that we need to create in the future in order to build a very concrete European Health Union. We need also to build a very good and parallel social social foundations in order to support our citizens and our Europeans. This is my comment, and I think that we need to reconsider whenever we talk about treatment and whenever we talk about rare disease patients.
Thank you, Stelios. I think one of the red threads that will go through our conversation in the 3 sessions today is looking at how the patient, the citizen, becomes the point of care. And I know that's one of the recommendations that came out of our working group on the European health data space and rare diseases, where you participated and helped to come up with that. We're going to be talking about that societal shift in the way we address healthcare, and that health is something that is not something done to you in an institution, but is more an interactive continuum that surrounds the individual wherever they are in the different aspects of their life, including social care and other services. Yes, please.
Thank you so much. Magda Krakowiak?
If you stand up, please, so we can
Yes,
see
of
which
course.
microphone it is. Go ahead.
Very good. Good morning, everyone. My name is Magda Krakowiak. I'm Director of Business Creation in EAT Health. I just wanted to, let's say, in patient engagement and citizen engagement in innovation. This is something what we have been trying to do for, let's say, since our inception in 2016, and many of our colleagues, they have spent their careers trying to do that. But before we get this kind of feel good, feeling around that now patients will be involved, they will be sitting in different boards, making decisions and choosing what is right for them and so on. I wanted to essentially plea to everyone to really think how we do it. So it's not only about having a citizen or a patient deciding about, let's say, possible treatments or saying what kind of innovation or where the innovation should be going, but it's about the right way of engaging patients. And here I'm, let's say, sharing a little bit of a frustration because we have been trying to do it right, and every time we go through lessons learned and we say, okay, so this time for sure it's going to work. It's not necessarily the case. So having patients involved is very, very important, but they have to be involved in the process in the right way.
Okay.
Okay, so this is definitely a good change, for patient not to be a subject, object, but to be a subject and to be part of the conversation. But if this is not done right, then I think we might be risking causing more damage.
Thank you.
Than not having patients involved.
Thank you. And I think that's something I might invite Jan to respond on, because obviously they have quite a lot of experience. Let me also see if we've got some other inputs from the floor at the same time that I could put to our panel. Does anyone else want to make a comment or ask a question? I see Alina will also want to come in. Yes, Kieran, if we could get a microphone here, it's just to your side there.
No, thank you. It's just to agree wholeheartedly with Jan. Having been involved in the British system around sharing data and chairing an advisory board to try and dig us out of a hole, one of the major lessons was you can only get consensus on the right way forward when you have the patient organisations, the privacy group, the clinical organisations and the regulators in the room at the same time. It's not enough to have binary conversations because the co-creation doesn't take place and somebody's interests will be written over. And I think we need to be really careful that the uses that people will be putting the data to have really been thought through, because things which came as surprises to particularly the privacy lobby, but also the patient lobby, almost derailed the whole project. So I think the design of the process of engagement is almost the most important thing.
Thank you. And Alina, I saw you nodding on that. Maybe you want to comment on that. And Jan, I'll bring you in on this as well. But Alina, go ahead.
Yeah, I just want to briefly comment what Magda and Kieran just said, because I fully agree. And often we are only asking when something is already out there and not in the process and in the design phase or even in the ideation phase when we are starting to brainstorm with the ideas. And I think we should start definitely much earlier and bring citizens and patient involvement. So it will be crucial also in the EHDS and their trust and if it's working for them. So definitely we have to pay more attention. But it is also a cultural shift among the healthcare workers. So it's not enough that we focus on citizens. It's not enough we focus on healthcare professionals. We have to work on several fronts and include the different stakeholder views. Also the researchers and how crucial role they will play in EHDS. So there will be a lot of different views around the table, but it's also essential.
Thank you. Jan, let me bring you in on this because we heard from Magda that it's hard to involve citizens and patients in innovation methods, and she keeps trying, keeps failing. And I suppose one message would be keep trying. There is no perfect solution. But we also heard from Kieran about the importance of everyone being in the room at the same time and making it a sort of rounded conversation rather than separate conversations. Do you have an example, Jan, of where you consider that we've really got it right in terms of bringing patients and citizens involved in that innovation cycle?
I think so, and I think that surely it's not easy. Surely it varies to context, but there is a lot that can really be learned from the experience, but also from joint projects which have delivered best practices, and there is also plenty of documents to guide these good practices now, and also trainings. So you can start by your website, but there was also different website that we could refer you to. I think the patient engagement really is taking place at different moment along the patient journey now. So I mentioned previously the European Reference Networks, but it's not only about being involved into the board of a network, it's about being involved into the working groups on diagnostic or newborn screening, in the registry, or in the guideline on good medical practice, or it's about precisely a working group on the patient journey in the healthcare system. So all that kind of activities are helping to bring really the patient voice at the right place. The challenges are always obviously to identify the persons who are able to do that. It's not easy, but also to provide the right support for it. So that's about training. The training doesn't always mean a full week. It can be very short, but adapted to the circumstances. The clarity, the first clarity that's needed is the why. And often there is confusion here. It's often a tick the box exercise to have the patients involved now. And it has to be more than that, and to be more authentic. I can take the example of the European Medicine Agency, which I mentioned before. And here, over the time, we have really collectively, together, between the patient community, particularly in the field of rare disease, but with the European Medicine Agency, developed the right way to do it. So how to identify a patient which is able to make a contribution because he or she understands what is the exercise, but also because the institution, the committee in question, or the procedure in question, are ready to accept the comments that will be made on certain elements in the discussion, so that then it's a real dialogue, there is a real co-constructions. If not, there is no value to bring a patient like that. Training is essential, but to have also staff support in the European Medicine Agency and in the patient groups to make it happen in the proper way is essential. If we leave it to random or just matchmaking electronic contact, that just doesn't work. It's a failure. And as important also is the management of the potential competing interests, which are very important, both for medical experts, but also for patient representatives. And I think now we've learned really how to do it well, and it works without any major problem over the last 20 years.
Thank you, Jan. Maciek, I know you wanted to make a comment.
Maybe just two more words to this. I think, from a research-based company perspective, I think it's about very important shift. It's a shift from typically environment in which scientists and clinicians have been running the research and they have been considered as the gods of knowledge, right? But I think in rare disease space we have very quickly learned that there is so much expertise and so much knowledge that actually is not with the physicians and clinicians and scientists, but actually with the patients themselves, their families, and that without understanding those perspectives thoroughly, you cannot design a proper trial or develop a proper solution or intervention. So it does require a significant either shift or actually a DNA of an organization programmed in a way that there's always that patient voice and there's always that patient centricity in the very center of our thinking. I think it's crucial. Otherwise, it's always going to be a challenge. So it has to start from the beginning.
Thank you, Stelios.
Yes, I totally agree with Maciej. We need patients in order to show us the direction. And then we will, from any point of this direction, we will fill the gap, even if political, scientific, research, whatever. But I think that patients need to be in the core of this procedure because we have lost many times the direction, and we want the civil society, whatever is this kind of civil society, to tell us, go there, because this is what I need in my daily life. This is I want as a priority, and I think that all together, sitting on the same table, we can feel this direction and we can follow the need of the people.
Thank you. Elena, I'm going to come back to you on an issue because we've been talking very much about health data spaces, but that's just one of multiple data platforms that the European Commission is putting forward. And when we talk about the citizen and the patient going about their daily life, we need environmental data, we need urban data, we need socioeconomic data, and all of that put together helps to build a picture of what's going on. So perhaps you could just make a comment about, the shift to digitization, which isn't just about health, it's about a number of different areas, including public services and use of that. How is the EHDS going to interact with these other data spaces that are being put on the table?
Indeed, very important question. I'm not sure if I have the answer how exactly, but indeed the Commission proposed already in 2020 the European data strategy. And in this data strategy, it's not only the health data space, but also 8 other data spaces, one on business and industry, transport, agriculture, Green Deal, and of course in this context the Green Deal data space will be highly important if we are looking at the environmental determinants of health. So looking at biodiversity, looking at food systems, looking at the chemicals and the exposures. So with the digital tools and the wearables and the sensors, and also with the help of environmental monitoring, we are getting a better grip what we are exposed to and what are the risks, how we can reduce those risks, what are the hotspots, where should we focus on. So in this sense, we have huge opportunities, but it of course also comes down to the data and how we will be able in the end to use it as citizens, but also as researchers. There are very good examples already how you can already monitor as a citizens your local environmental air pollution. There are different kind of portable devices. We have the wearables that you can monitor your health. So what we would really need is to combine this data and make it interoperable, but then also to have someone and the clever apps and the software to interpret that.
Thank you. Let me open the floor if anyone wants to make a question or comment from the floor. We're touching here on the role of digitization as part of the societal shift that we've been talking about, and this interesting point that connecting in the health data space with other data is really important. I mean, every aspect of our life, the monitoring the air pollution that's outside, monitoring transport use so that public services can be put in place, monitoring who needs what social care, it all is based on data, and we need to make sure that that information is taken into account so that patients don't just have a role in healthcare systems, but also into broader society. We have a question over there. If you could stand up so I could see you and just introduce yourself and go ahead.
Good morning, Jane Barrett from the International Federation on Ageing, and thank you to all the speakers. 2 questions. 46% of the world's population are not connected. How do we deal with that? And secondly, none of us in any country of the world is very good at collecting age disaggregated data. And this is one of the burning issues of our time, isn't it? How do we deal with that?
Thank you, Jane. You have indeed put some challenges for us, and I know we will touch on that a little bit later. But let me, who would like to pick up on this first? Maybe Alina, I'm going to start with you because on this issue of disaggregated data, you're sitting there with member states and stakeholders. To what extent are people looking not just at data collection, but disaggregating data on gender, on age, on ethnicity, so that we can start to understand the hidden patterns of discrimination or access that we need to address?
Yeah, that's a very good question and very important, of course. And in research, sometimes it's forgotten the sex and the gender data, and we focus only on some of the aspects. But it's getting more and more attention. So definitely these are discussed because it's meaningful data for our health. Regarding the connectivity issue, I fully agree. I was just a few weeks ago in the World Health Summit, where the discussions are slightly different compared with the European ones, because it comes a lot to the lack of access, not only in terms of the sort of internet and digitalization access, but real lack of access to any kind of healthcare system, any kind of health services. So yeah, we can develop also some services if we think about technologies and the digitalization, that you don't have to be online all the time, but you can then upload the data sometime when you are more in the sort of area where that is possible. There are some platforms and tools for that already existing, but these are very rare. Some are more focused on sort of mobile health type of applications and tools. But that's a huge challenge, and it's definitely important to keep attention also to this question and find the answers.
Thank you, Alina. And I'm going to come to you in a moment, Stelios, as well, to respond on that. But just let me highlight that the European Commission's own data shows that we have between 25 and 30% of our population that lack functional literacy, whether that's classical literacy or digital literacy. So even within the EU, we have challenges. We may have our high penetration of mobile phones, but that doesn't mean that everyone has the capacity to use it. And my mother is 80, and I had to spend some time with her this summer helping her, because in order to interact with the Commune of Brussels, you need an app. In order to prove your identity, you have to have the It's Me app. In order to have your COVID vaccination, you needed that something on the phone, without which you couldn't access anything. And I spent quite a lot of time helping her to understand that. And to the point that I replaced both of our phones, so we have exactly the same model, so that if she had an issue, I could talk her through it because I would know what to do. It got to that point that I needed to do that. So Stelios, I know this is an interest for you, particularly coming from Greece, where you've got small islands and rural populations. So some of this challenge of lack of infrastructure and then lack of capacity or literacy to use all of these things. What would you like to share?
Yes, I think that the aging is not the obstacle. The thing is, because I'm afraid that even if we have young generation, sometimes they don't know how to use in the right way in order to do all these things. Yes, they can go into It's Me app application, but after that, what's happening? And this is the thing that we need to show and to raise the awareness and educate the right use of digital everything. It's because we are living in the digital era, and we need to be on the position that we know what we have on our heads, on our hands, because this tool could be a knife. A knife can cut or can kill. So I think that because we are at the moment that because we are building up this digital, because we are still in the process, we need to show the right process. And I think I want to say something about 46% of lack of having access. Therefore, we are here as stakeholders and policy makers in order to show that everybody needs this access, not only on European level, but also worldwide and third countries. Therefore, I think that we need, from our opinions, our text, we know to show that on this era is the right for someone to have access to digital epoch. I think this is my opinion, and I believe that we will face in the future more and more.
Thank you. Maciek.
I'm not an expert in this, but I maybe just I can add one or two perspectives on this. I mean, first, I think we should be optimistic about the prospects. There are more mobile phones than people right now on this planet, and probably this tells us a lot about the future designs that need to be driven in healthcare. Maybe it's completely different platforms that we should be using. Just one, maybe provocative food for thought, but I mean, I've seen those examples in as some business cases now explained to different organizations. When we look at what's happening in China with one app, which is called WeChat, they operate everything from the one app, including all of the healthcare appointments, all of the health data that they have available for one app. I think that's probably a very significant change between what we have in Europe with a huge number of apps everyone needs to navigate. Maybe it's not the simplest way of doing things. So there's probably some food for thought for the future, but definitely the platforms, the fact that everyone has mobile phone these days pretty much, and even more than one, that's probably creating so much more opportunity than problems, and really, I mean, more than ever before. So that's the call for optimism.
Thank you. Jan, can I bring you back in on this one? Because we're talking here about inclusion and making sure that we have the data that gives us the information, whether it's disaggregated on age or anything else. For rare disease patients, not only are they having to navigate a complex health system to try and get a diagnosis, and we know that that diagnosis journey can be very long, but also now we're expecting the rare disease patients or other patients to then become experts in digital tools and to link all of these different processes. How much of a barrier or a facilitator do you see digital tools for citizens to become more active in the future?
I don't know really how much a barrier that will become when you see what most people are able to do with their mobile phone today. So I recognize that there might be parts of the population either linked to age for the most aged persons, but or lack of general literacy that may struggle with it. But when we look at what people are able to do today with their apps on their phone, I think they should be able to do that properly. It's a matter on how the tools are being developed so to be friendly to the persons or to the patients. Then in the case of diseases like rare disease and other chronic disease, it's a bit different because your health literacy increases. You are more knowledgeable about your disease, you're more knowledgeable about what is important, you're being briefed potentially by your doctor about what's important also, and you have your community where you can refer to and the social media where you can refer to. So I'm not sure that's going to be such a barrier in our case. I think in our case what we have more is still some of the basics of the awareness of what are the signs that it may be a rare disease in order to speed up access to diagnosis. But after that, using an app, for instance, to enter some of the symptoms that you observe as a parent, as a grandparent, as a brother and sister, and to progressively refine, could that be a rare disease in this type of therapeutic areas and be oriented to the right specialist or the potential centers? That I don't. From our experience today, we don't see a major health literacy issue here. I think it's really what we do with the tools. And you mentioned at the beginning, Tamsin, the huge changes due to COVID. Yes, that's true, and we have communicated about it. The use particularly of more telemedicines for consultations or for renewal of prescriptions or for therapeutic education. But I'm really worried about how fast we're going back to the previous world, and how little we're learning from all these experiences. The system is very conservative and resistant, not only resilient. And for instance, we are not taking advantage of the fact that thanks to telemedicine, it's now possible to have your pediatrician or your family doctor participating to the meeting with your hospital doctor in order to have a better follow-up and a renewal of prescriptions and maybe a better reporting of an issue rather than leaving us every time on a one-to-one in different discussions. So we are not building because then it's complicated. How do you get the doctor being reimbursed? How do you organize all that? So it's more for me a resistance of the system than a lack of health literacy. I'm not ignoring the health literacy issue in general, but I think it starts much before the questions of data. Then it's all about education and how we leverage overall the media, but also school to educate people about prevention and reducing their risk over their lifetime. That will be, in terms of healthcare impact for me, a much higher impact than really looking only on the capacity of using digital tools.
Thank you, Jan. Just before I pass to André Rees to close us, I'd like to invite a quick message from, we're delighted to have the Serving Minister of Health from Latvia here in the audience, Daniels Pavluk. Please go ahead.
Yeah. Thank you, Tamsin, and thank you everyone here on the panel. Is there any way we can bring Slido back? I was wondering if you're going to do this.
You want to see the slide that
Yeah.
we did? Yes, we can put them up on screen.
Just in light of what Maciej has been talking about, and Jan actually.
The results of that slide,
Yes,
there we go.
yes. We have this session called What Will Be the Key to Empowering Citizens? And in fact, of course, this is a question, what came first, chicken or the egg? But it seems that this expert audience has come up with the unanimous answer that it's an egg or chicken. I don't know which, but one of the other. Yeah. So while in fact it's both. And it seems we do not really trust the citizens in, getting empowered and doing things on their own, if we look at the results of the poll. And I think that we're misleading ourselves. We still think that the locus of control is with us the doctors, us the educators, while in fact the digital disruption, digitization of various industries has shown the opposite. The technology enables us to do things we never thought were possible, and then the experts and specialists need to adapt and catch up fast. So I think we're misleading ourselves a little bit here, and we should be open to possibility that things might not go the way we expect. Thank you.
Thank you very much for that, and again, very thought-provoking. I'm going to invite André Rees, who's the Chief Scientific Officer and Advisor in DG Santé, just to reflect on what you've just heard. And if I can invite you to look forward. As I said, we're a year away from the big institutional game of musical chairs, when we'll have new members of the European Parliament, new European Commission. What are our hopes? What should we be passing to them on their to-do list and their already accomplished list?
Okay, good morning, everybody. So I am in this new role since a few weeks. So I used to be for more than 16 years, regulating, pushing, managing policy development and regulation. But let me start from, I will try to, I got 5 minutes. I will stick to the 5 minutes. So I will start from this very, very beautiful questions, citizens, consumer, patients, because we really are in this I don't know, you said chicken and egg, this is the quite complex issue, because one day we are citizens, putting our votes, for our beautiful future parliamentarians. Other day we are consumers, because we have so many choices today, many of them, healthy driven, and finally we are patients when we start to exercise, like happened also to me in my current life. So this is the first things I think we should keep in mind in this whole debate. From voting, our rights, also rights to get access to internet. In the report we made, few months ago, published in Lancet, from the Commission on Future Digital 2030, we're saying this is like a human rights today, access to the net. So I think we really, as a citizens, we have to make this happen. New technologies is a challenge, and I fully agree with this disruptive way technologies are happening. I think this is the huge challenge for all of us, because this is how we are going to build the future. It very much depends, on this disruptive idea. I think Jan said something which I agree about this kind of fight with the conservative system we are dealing with. Usually I ask question in audience, what do you like, to be operated by a conservative or innovative surgeon? And I can tell you, when you get this question, half the decision is half-half, because, some of us would like to take the risk, get for innovation, others prefer to be in this conservative setup. But for sure, disruptive of technology is coming. Data, I think this will continue to be the big debate for many reasons. We are moving from this my data to the ours data. So I think what was said about the future, we continue to have very interesting questions about the implementation of hopefully agreed European health data space. This is a huge effort ahead of us. So I will now say a few words about because we have important legislative agenda going on in the European Parliament and in the Council. We have European data space, we have substance of human origins, we have hopefully pharma coming soon. So there will be a package of things to be implemented. The implementation is more difficult than even developing of new legislation. Tobacco is now under evaluation, important, again, regulatory issues for the future. We have to build on health security, because I think citizens will not forget what's happened with the COVID. And I think we, as was said, in the beginning, this agenda around health security should be stabilized, should be explained to citizens, because I think most probably, of course, the human memory is vanishing very quick, but I think that we know that frankly speaking, when I finished my journey with H1N1 pandemics, I said it's enough for my period. The commission, it came, with COVID. So I think we have to be ready for next. Whole debate around health literacy, I think it will continue, and I think what is also, as we have seen from our voting, the role of health professionals and the role of patients and the interactions. And COVID showed that I recently spoke to pharmacists, and they started to do the vaccination, which was not imaginable for many. They started to do testing, but what's happened? We all know how to do swab and do antigen tests. It was unimaginable, 3 years ago. So there are new roles we can find in the system and do better. And now I think it's important, I'll try to conclude, something we discuss around the rare diseases and the community of practice and all these developments done around this. I think it is an excellent model to be also developed, continue to be stabilized, and also show to others, because I think this, I fully agree with all speakers, that we created something which is very unique, but I think we should harvest more from this, from the system. And the last point is on this cross-sectoral issues. The data should be used, in the benefit of our individual choices, but also our treatments, our ability to develop new products, but also assess them. And somehow, I think this journey with data will be continued, because they will help us hopefully to find also common language of working together. So I am optimistic. I believe this is what Maciej said, that we can do more. We are coming to the new era. Of course, we should not forget about this big security issue just next border to us, because this, of course, will not vanish very quick. Thank you.
Thank you very much, Andrei. And can I say a warm thank you to the members of our panel, to Alina, to Maciej, to Jan, and to Stelios. And I'm now going to offer you the coffee break, and that will be downstairs. When we come back, and we'll start at 11 o'clock, we're going to have a fantastic intervention by Lubna Bouafra, who is a pioneer in the use of AI in health systems. So we're going to tackle some of the issues we talked about and hear how that potential could be realized. So thank you to our panel, and see you after the coffee break.